All right, joining us now to talk more about this Day of Giving is Dr. Jay Schuur, Physician-in-Chief for Emergency Medicine at Lifespan. Thank you so much for joining us.
It's my pleasure to join you.
So tell us about the state of emergency medicine in Rhode Island today.
So Rhode Island has a long history of having really cutting-edge emergency care. We've had one of the earliest emergency training programs in the country, and nowadays we have state-of-the-art care for trauma, strokes, heart attacks. The last 2 years have been a real challenge, and we've been really proud to provide cutting-edge care for COVID and all of the other things through the pandemic. But it's taken a toll on the workforce and on the emergency departments in the state.
Yeah, we know COVID turned so many things upside down, and things are different now even than just a few months ago. How have things changed?
So the good news is many fewer cases of COVID. Our state has a high vaccination rate. The biggest challenge is with the workforce. People have probably heard we've had people leave healthcare, particularly in the hospital setting where it's been very stressful. And so we have plenty of staff in the emergency department, but we need to make sure that we're keeping staff engaged, helping their well-being, and recruiting additional staff.
Yeah, obviously with staffing levels being an issue, how are the levels and is the staff holding up?
So the staff are holding up. I think right now COVID has gone down, and we're back to doing the things that we all come to work to do, which is take care of people in their time of need. We're hoping that we don't see another surge like we've seen in the past, and but we have to prepare for that.
Yeah. Are you hopeful to be able to bring some of these people who have left the field, bring them back, or replenish the ranks?
Both of those. Yeah. And so there are active programs at Lifespan and at other hospitals across the state to encourage new employees, continue training, and really recognize the people who've served through the pandemic.
Yeah, we know we have so many generous viewers out there. We know they're going to donate to this Day of Giving. How will their donations directly impact emergency care at Rhode Island Hospital?
So one of the things we're going to do is refurbish the emergency department and help with patient experience. So we've had to do a lot of things the last couple of years, increasing ventilation, putting up barriers, and it's taken a toll on the physical space. And so it's not the experience that we want for patients when they come in, and how a patient experiences the environment influences their care and their staff. So we're going to be doing some painting, some light repairs. We're also going to be adding some comfort for people who have to wait with patients, coffee and things like that, and also some video monitors to help people know what the waiting times are and make sure that patients in rooms have videos to watch.
Yeah, we know that patients come from all over the region to come to the emergency department at Rhode Island Hospital. How important is that setting for the people who come here in terms of providing the care?
So it's really important. It's the only level 1 trauma center in the state. It's the primary comprehensive stroke center for the state. It provides the highest level of care for cardiac emergencies and other surgical emergencies. And so patients who arrive at community hospitals, both here and in southeastern New England, will often wind up there for advanced care. And so in addition to providing care for the greater Providence region, we really provide advanced emergency care for the southeastern New England region.
All right, Dr. Jay Schuur, thank you so much.
Thank you.
Okay, guys, all gifts during this hour will be doubled thanks to the generous support of Lynn and Robert Manning and Friends of Rhode Island Hospital. And remember, volunteers are standing by. You can see them on our screen right now to take your donation on the Day of Giving with Rhode Island Hospital. So let's get those phones ringing. You can see they're ready for it. You can call 855-551-GIVE. You can text RIH to 44321 or go online to rihdayofgiving.org. But first,